Hello everyone, today we will learn about selective grinding. What is selective grinding and why do we do it? So first is what? That is selective grinding, or we can say occlusal equilibration, is a procedure by which the occlusal surfaces of the teeth are precisely altered. So this is selective grinding. Why do we do it? We do it to improve the overall contact pattern. So we have these occlusal contacts and we want them aligned. We want overall contact on all the teeth. So this is our purpose, this is our why, and for that we do selective grinding. Now how do we do it? Let's understand that. We have to understand whether we need occlusal equilibration or not, or do we have other options. For that we have rule of third. Suppose you divide this incline, the inner incline of upper teeth, in three parts. Based on where your opposite teeth is contacting, you have different options. So first, suppose your opposite teeth is contacting the third, which is nearer to the fossa. If your opposite teeth is contacting here and then it glides here, if this is the case, then you can go for occlusal equilibration. So if your teeth is contacting here and then it glides here, so interference is somewhat here only, then you can go for occlusal equilibration. You can just grind away the irregularity and your teeth will be in proper contact. But suppose your teeth is contacting here, that is the middle third of the incline. If this is the case, then you will have to grind so much teeth. Then only your opposite teeth will be in proper contact, right? So in this scenario, it is not advisable to just do occlusal equilibration because your so much teeth structure would be lost. So in this scenario, you will need to provide a restoration. Third option is, if your opposing tooth, especially the tip of the cusp, is contacting here and then tooth moves in this direction. If this is the case, then you have to do orthodontic treatment. You have to move the opposite tooth toward the proper arrangement, toward the proper alignment. So these are all the three options available based on the amount of discrepancy, how much discrepancy is there and what is the location of interference. Now let's start with the occlusal interference elimination. We will divide this portion in three parts. First, in centric relation, second will be the lateral excursive movement, and third will be the protrusive movement. Starting with the centric relation position. So first we will eliminate the interferences in centric relation position. If you guys know what is centric relation, it is terminal hinge position where your condyles are in most superior and anterior position of the fossa. And during this position, when mandible rotates, it will not translate, it will just rotate around this axis. So this is also called as terminal hinge axis position. First step will be elimination of interference in this position. So suppose our mandible is moving in rotatory movement in this way, then first will be the contact elimination in this centric relation. This will be divided in two parts. First, the arc of closure, and second will be the line of closure. What is the arc of closure and line of closure? Let's understand. First is arc of closure. Suppose you are looking at the mandible from the sagittal plane. So if you see from here, when mandible opens in this way, your tooth will be moving. Suppose this is the radius, it will make an arc. This will be the arc of motion. So mandible will close in this arc, considering this as the center and this is the radius. So mandible will move in this direction in the arc of closure. This is called as arc of closure. Second is the line of closure. Suppose you are looking at the mandible from the front view, you are looking at the mandible in the coronal plane. In this direction, when mandible closes, your posterior tooth will be in this motion. The motion of the posterior teeth will be like the straight line. Your lower teeth will just occlude directly to the upper tooth. This is the line of closure. Our first step will be removal of interference in this movement. How do we do that? Let's understand that. As we have discussed, this teeth will be, suppose this teeth is moving in this direction. So this is the arc of closure. If there is an interference, your teeth, suppose this is the interference. So then your teeth will just hit here and then slide here. It will first hit and then slide. So we have to remove this interference. Similarly, there may be interference here. Your teeth will hit and slide. In this case, we have two options for removal of interference. First, you just remove this portion of upper teeth so that your lower teeth just glides in the proper position, right? So we have to remove this portion of upper teeth. This is the mesial slope of upper teeth. This is the mesial slope of upper teeth. Or we can remove this portion of lower teeth. So this is the distal portion or distal incline of lower teeth. So for the arc of closure, we have two options. First, mesial incline of upper teeth. So we remove inclines on the mesial slopes, or we remove the distal inclines of lower teeth. So you have MUDL rule for arc of closure. We have seen the arc of closure where we see the mandible from the sagittal plane. Now we are looking at the mandible from the front. That is, we are looking at the mandible in the coronal section. When we see that, we have two options. First, our teeth may just hit here and then glides here. So here we have interference. That is, suppose we are talking about this teeth, right side. This is right side, this is left side, and we are looking at the right side. This is buccal side, this is lingual side. This is buccal, this is lingual. We are looking from the coronal plane. So when opposite teeth is hitting here and then just glides, we have interference here. The mandible is sliding toward the cheek, that is buccal portion. If this is the case, we have to remove this portion, that is buccal incline of upper teeth, or we can remove this portion, because when it is contacting here, only this part is contacting. Your lower teeth will be here after the occlusion. So this is only part which is contacting. So either you can grind or you can selectively grind the buccal incline of lingual cusp, of upper teeth, or you can grind away the lingual incline of lower teeth, So you can either grind away buccal incline of upper or lingual incline of lower teeth. This is the condition when your teeth is contacting and then sliding toward the cheek. But suppose your teeth is moving toward the tongue. You may have conditions like this. Your cusp is contacting here and then your teeth is sliding here. In this scenario, your teeth will be here. If this is the case, you have interferences here or here. So this will be the area with interference, and you have to grind away that. So here, when your mandible is sliding toward the tongue, you will grind the lingual incline of upper teeth or buccal incline of lower teeth. So here it will be opposite. So this was about line of closure. Here there may be interference in this slope also. Then also the condition will be the same. You have to grind away the lingual portion of upper teeth and buccal slope or buccal cusp, buccal incline of lower. So this was about arc of closure and line of closure. Till here we have completed the centric relation bite. So we have achieved the interference free occlusion in centric relation. Now our centric relation have no interference. Our second step will be the lateral excursion. How we will remove the interferences in lateral excursion. Let's understand that. We are looking from the front. This is our working, this is our right side, this is our left side. Suppose all the teeth are in contact in centric relation. Now we have achieved the centric relation occlusion properly. Now suppose our mandible is moving toward the right side, When mandible moves toward the right side, the right condyle will be the working condyle and the left condyle will be the balancing condyle or non-working condyle. And similarly, the teeth on the right side will be the working teeth or working contact, and the left side teeth will be the non-working side or balancing side. Let's understand what happens at the working side. Suppose we have interference on the working side, what do we do? So suppose here we have the complete balanced occlusion in centric relation, and now our mandible is moving in this direction, right? Downward and right side. So this is our working side. This is buccal side, lingual, buccal, lingual. This is maxillary molar, mandibular molar. We are looking from the front. This is the scenario. Now suppose there is an interference. It may be either here or here or here or here. There can be 4 different planes where there can be an interference. So to remove that interference, either here or here or here or here, we can grind any tooth, any cusp. But as we have seen in the centric relation, we have already touched this and this cusp. This cusp and this cusp are our centric holding cusp. These are both the most important cusps because they are holding their position in the centric relation. So we try to avoid touching these cusps. Okay, so our target will be this and this cusps, which are non-functional cusps, which are not in the centric relation, centric holding position. So we have this and this. So we can grind this part. This is the lingual incline of upper buccal cusp. Because we are mainly focusing on the buccal cusp, this will be the lingual incline of upper buccal cusp, or we can grind this part. Because we have already touched this area, we will not touch these 2 cusps. We are not touching it. So we will directly focus here and we will grind these teeth. We will grind this inclination. This is buccal incline of lower lingual cusp. This is the buccal incline of lower lingual cusp. Right? So this is the case. For working side, we have talked about working side. So till now we have talked about working side. We have covered the centric relation, the arc of closure, the line of closure, how do we eliminate the interferences in centric relation. Then we have come to lateral excursive movements where we have covered the working side. This is the working side. Now we are talking about the non-working side. What will happen in this area, right? Because our mandible will move in this direction. So in the working side, this was the contact, lower teeth came here. So from here, our teeth came here, 8 to 8 position. This is the working side. in the non-working or balancing side, situation is different. So this is the non-working side, this is buccal, this is lingual part. We are talking about this portion, this portion. So this is buccal, lingual, our teeth is moving in this direction. The only surface that is contacting is this. The teeth will just glide over this surface only. So we have only one option here, that is either this surface or this surface. If there is an interference in any of this surface, we have to remove it. So for balancing side, in the lateral excursive movement, if there is an interference, the rule is this, that is buccal incline of upper lingual teeth, buccal incline of upper lingual cusp, or lingual incline of lower buccal cusp, or we can say that lingual incline of buccal cusp of lower teeth. So this and this will be the rule for balancing side in lateral excursive movements when our mandible is moving toward the right side. This is as the balancing side, the lower teeth is moving toward the medial side. It can be also called as mediotrusive movement, and here from the medial to laterally it is moving, the teeth is moving, it can be called as laterotrusive movement, So this was all about lateral excursive movement, how teeth will glide, and if there is an interference, what are the rules to remove those interferences. Till now we have covered centric relation and lateral excursive movement. Last is, what do we do in protrusive movement? So this is the condition here. We have achieved the centric relation or centric occlusion. All teeth are contacting in centric position, terminal hinge axis position. All the teeth are contacting properly. There is no interference in terminal hinge axis or centric occlusal position. We have already achieved lateral excursive balance. That is, we have eliminated all the interferences in lateral excursive movement. Now, what happens when our mandible moves anteriorly, that is downward and forward? In this case, the motion will be governed by our incisal guidance. Incisal guidance is the lingual slope of maxillary teeth. So suppose our incisal guidance is like this. Your lower teeth, lower incisor is moving in this direction on the lingual fossa of maxillary teeth. Then all the posteriors will also move in that direction, exactly that angle. Okay, so this is the direction of mandible moving anteriorly, protrusive. So all the teeth are in contact and now mandible is moving anteriorly, right? So this is the case. This is our mandibular molar, this is our maxillary molar, this is mesial and distal, this is mesial side, distal side. Now suppose our teeth is moving in this direction, only contact area is this, right? So if there is an interference, we have two options, either we can grind away this or we can grind away this part, because there will be interference only in this area. So for this position, that is the elimination in protrusive interference, we have either one, the distal incline of upper, or we have mesial incline of lower, that is DUML again. So when your mandible is moving anteriorly, that is gliding anteriorly, this will be the case. It is opposite to the centric relation, that is the arc of closure, where we have to grind this part. So for the arc of closure, the rule was different. For the protrusive interference, the rule is different. So this was all about occlusal equilibration or selective grinding. I hope all the doubts are clear. If you still have any doubt, you can contact me or you can comment in the comment section. Thank you.